So once again, welcome back to Boniwasan's Academy. Yet another very interesting and very practically useful experience I will share with all of you. So we have all heard and read in our textbooks that this famous symptom, colds settle in the chest. But if you see in the clinics, very little usage of this symptom is seen. Not very often we have seen physicians using this symptom or rubric. This rubric is given only in Murphy's repertory under the chapter clinical and under the chapter of nose. It says cold tendency to goes to the chest. In the clinical section, the rubric has 9 remedies, and in the nose section, the rubric has 7 remedies. So I had this opportunity to use this rubric in the clinic, and I shared this case with you. So there was this young toddler who was brought to me because he suffered from bronchiolitis, and this was his second attack. And in the course of the history, I see that there were 2 instances where this child begins to develop coryza, and then the coryza ends into bronchiolitis and a bronchospasm, and on both instances he had to be admitted into the ICU to maintain his oxygenation. Now, so what is so fascinating, what is so peculiar about this kind of a history? Now, this patient incidentally was from the US, and they have this very meticulous working and diagnosis of every possible condition, and I get to learn from the old notes that the first infection was from a respiratory syncytial virus, which we call as the RSV infection, and the second from the rhinovirus. Now, in the natural course, the rhinovirus as well as the respiratory syncytial virus infection is a very mild infection, hardly makes you very sick. But in this child, both these very mild infections did not remain mild, but went on to become life-threatening emergencies. Now, this is the peculiarity of the case. And also, we need to understand the pattern in which the vital force is expressing itself in this boy, in this child. A little more history will tell us something, a newer, more dimension in the case. This child was born with a congenital hypospadias, which was corrected at 8 months of age. And this child did not cry immediately after birth, as he was born with a cord around the neck. Also, during the labor, the upper limb was impacted into the birth canal, and they had to very carefully deliver this child. So, and the mother had a very, very difficult time. In fact, she had diabetes during pregnancy, and we see that the tubercular miasm to syphilitic miasm is seen right from the birth. And here, in these 2 complaints, we see the expressions of these miasm. And it also tells us the ability, the defenses of this child are very poor. Therefore, in this case, with of course the other detailed history, the 2 very important symptoms for me was colds settle in the chest and reaction poor. So this is how one will use this rubric or this symptom that every cold settles in the chest. So I hope you like this information and this experience. Do share the video, subscribe to our channel, and see you back again with some more interesting experiences. Goodbye.